Previously, I talked about coronavirus treatment with the remdesivir trial. Today, I'm going to talk about what should you do if you think you got infected with coronavirus. First of all, there are so many people who's getting infected nowadays, so it is somewhat rare to see somebody who are exposed to infected person who cough on their face, right? So most of the people who are going around and getting infected are transmitted from somebody who is mildly symptomatic or asymptomatic. Therefore, oftentimes we don't know if we are infected, but we start to have a symptom, and then subsequently those people are diagnosed with coronavirus. So what are the symptoms? You can easily find those symptoms from internet, but let's talk about that. It is pretty simple, straightforward. It looks like a common cold, plus some additional finding. So somebody who get infected with the coronavirus will have fever or chill, shortness of breath, or difficulty breathing on the worst case. Cough and runny nose are very common. Sore throats are common. Fatigue, muscle or body aches, headaches. These are fairly common for common cold or flu. And if you have a coronavirus or a severe respiratory infection, including pneumonia, you can have confusion, right? Somewhat different, but not really brand new, is new loss of taste or smell. I mean, you can have a respiratory infection and nasal congestion and lose the taste or sense of smell for regular common cold as well. But this is somewhat characteristic. We are finding more people with this symptom than common cold. Also, nausea, vomiting, or diarrhea, or abdominal pain. GI symptom is also common. So you may have 4 or 5 different symptoms, or you may have a couple of symptoms completely unaware that you may have coronavirus. So these are the symptoms you can easily find from the internet. But the question is, what should I expect? Or what should I do if I get infected or if I suspect that I have a coronavirus? And also because of pandemic and news media is talking about it so much, and then we hear so many people are dying, people are so concerned. What's going to happen to me if I get infected? So first of all, let's talk about the most worrisome things, right? If you get coronavirus, what is the worst case? Such symptoms are trouble breathing, like shortness of breath and unable to breathe, right? Or persistent chest pain or chest pressure, which indicative of heart attack, or it could be coronavirus-related cardiomyopathy, so-called viral cardiomyopathy. Or if you get a new confusion, that means you are becoming septic, or encephalitis, or infection in the brain is happening, or sepsis is getting worse. And same line of the thought is inability to wake or stay awake, meaning that you're getting confused or you're getting lethargic, mentation is changing. And also, obviously, bluish lips or face. If you look blue, then you need to go to ER, right? There's no question about it. In such a case, you need to call 911 or go to local emergency department. However, if you go to ER, then you need to call ER ahead of time to tell them that you are coming in for possible COVID infection so that they can prepare and isolate you so that you do not infect other people. Also, if you are going there with this kind of symptom, please do not drive to the emergency room. If you are going to use your private vehicle, then have somebody else drive for you. Because just like I said, if you are not able to stay awake, or if you have a chest pain, acute heart attack from coronavirus, then your heart may stop. Or if you lose consciousness, then you get into big trouble while you are driving. So please do not drive to the emergency room. Make sure somebody else take you there. So I already told you the most scariest part. Then you will be wondering, what is my chance of getting hospitalized, or what is my chance of death or some kind of big problem, right? We can reference to CDC data. COVID-19 associated hospitalization rate is 151 cases for 100,000 cases. That is average throughout. However, if you are 65 years old or older, then your chance of getting hospitalized is much higher at 412.9 per 100,000 cases. If you are 50 to 64 years old, you are still higher than average at 228 cases per 100,000. In California, as of August 21st, 2020, which is today, there are 650,336 cases. Today, there was 5,585 more cases reported. And hospitalization-wise, there are COVID-19 confirmed hospitalization of 4,772 cases, and suspected COVID-19 patients are 1,267. So let's look into a little more localized area. I live in LA, so let's talk about LA County. Today, LA County report 1,644 new cases with total of 230,662 cases, and there were 48 deaths. So if you simply calculate number of deaths for number of cases today, there are 48 deaths for 1,644 cases. So if you divide that, then you are saying, well, out of those cases, there are 2.9% chance that these people will die. However, if you diagnose today, you don't die today. So dividing that doesn't really give you a correct number, but I'm just giving you an easy way to calculate to see what's the status. So don't try to criticize me that that's not a correct formula. So the question is, if I suspect coronavirus infection, what should I do? I have two patients who were diagnosed yesterday, and they've been calling me multiple times throughout the day because they don't know what to do. So I'm going to tell you what you can expect and what you should do in the case of if you are suspected or diagnosed of COVID-19. Well, the California Department of Public Health, if you are suspected of COVID-19, you call your doctor, and the doctor will advise you to either come into the office or stay home in a mild case, symptomatically treat. Or obviously, in emergency case, you need to go to ER if symptom is really bad. However, there is a big thing missing here. So I really don't like that diagram. Because when patients are suspected of COVID-19, they are going to call the doctors and they want to come into the clinic. Well, obviously, if you are suspected of COVID-19, you should not be coming into the clinic. Unless that facility, the room has to be equipped with airborne protection. I do not know any clinic in America that have airborne protective room in any clinic at all. It only exists in big hospital. So practically, there is absolutely no single clinic that has airborne protective facility. So basically, you should not be going to the clinic, right? So I'm going to tell you the practical way of how things are done. The practical guidelines stay the same. If you are short of breath, if you have a chest pain, if you are confused, your mentation is changed, you need to call 911 or you need to be taken to ER by somebody. Again, you should not drive yourself. Let's talk about mild symptom. If you only have a mild symptom, do not go to the clinic. Just call your doctor. Because if you just walk into the clinic because you are feeling sick and you are only thinking about yourself, well, the problem is you are exposing everybody in the clinic, not just doctor and nurses, but the people in the lobby and anybody around there. I actually had an argument with a couple of patients who said, I'm sick, so that's why I came to the clinic without calling because they are sick. So the doctor should be taken care of. That line of thought is very, very selfish because you expose about 20 people in the clinic. So it is very, very important. You need to call your doctor and talk about your symptom and follow their instruction. So in mild coronavirus case, the symptom would be mild fever, mild cough, and some runny nose. However, the breathing is normal. You are not short of breath. There is no significant swelling that is gotten worse. If you have chronic heart failure, you may already have a swelling. So I'm talking about worsening of swelling. You don't have a chest pain and you should not have a mental change. If you have one of those symptoms, then you are classified as severe, right? So if you do not have those symptoms, the treatment is symptomatic treatment. You take Tylenol for fever and pain, and you can take over-the-counter cold medicine like Mucinex, Nyquil, Robitussin for cough, things like that. Just like what you would take for common cold. Because this is called coronavirus. We had coronavirus for a long time. Every year, millions of people get coronavirus. This year, when we are talking about coronavirus, we are talking about COVID-19, new mutated coronavirus. But the thing is, if you do not have a severe symptom of coronavirus, then basically the treatment of coronavirus or COVID-19 are about the same. because it's the same damn coronavirus with a little twist, with a higher impact on your body that cause more problem. But if you only have a mild symptom and you are one of those people who recover spontaneously, then it's kind of like bad cold for those people. I'm not talking about the one who's getting short of breath and go to hospital, okay? So if you have a symptom little worse than the mild case, that may include mild shortness of breath. If you get really a bad cold, or if you have a very mild pneumonia, then you get a little short of breath. I'm talking about that much, okay? If you are having really shortness of breath, you need to call 911. On moderate symptom, some mild shortness of breath, you still have a cough, you have some fever, then you definitely need to call your doctor. And if you have a that moderate symptom and you are going to talk to your doctor, you should be giving some objective data. You should check your blood pressure, check your temperature, and sometime if you know your oxygen saturation, that will be helpful very much on a moderate case. Mild case, you are not short of breath, you probably don't have desaturation issue, but on a moderate side, I have seen people who desaturate some degree, did not require hospitalization, but they may need to be intensely monitored at home, if not too bad. And the daily weight. Daily weight is important because COVID-19 was known to cause viral cardiomyopathy. We knew that from H1N1 influenza virus, we knew that from SARS, we knew that from MERS. These viruses can cause acute cardiomyopathy, meaning heart failure. If you start to get swelling, then you are going to have weight gain, suddenly weight gain. And then you are going to have a shortness of breath. So if your weight is start to change, you definitely need to inform your doctor and likely you need to go to ER. On those people with moderate symptoms, still it is symptomatic treatment. So you can still take Tylenol for fever. So far, some articles have shown that if you are taking NSAID like ibuprofen, naproxen, or Celebrex, they can cause more problem and it can also cause kidney failure. So we want to avoid that for now. And you want to monitor your breathing issue. So if you have a mild worsening of shortness of breath, you may need to get a chest x-ray or oftentimes CT chest, because chest x-ray does not show significant problem. And on COVID-19 patient, we have found that chest x-ray may look okay, but CT scan looks horrible. Again, you should be checking daily weight to make sure you are not gaining weight. Because if you have a COVID-19 and sick like a dog, you probably are not eating. And if you are gaining weight, there's absolutely no way that you are getting fat while you are sick like a dog. So if you are gaining weight while you are having moderate degree of COVID-19 symptom, then that means your heart may have a problem from viral cardiomyopathy. But if you already have congestive heart failure as baseline, if you have a comorbid condition like that, it will acutely get worse. And those people need to go to hospital. Unlike bacterial pneumonia, many people feel okay or only mildly short of breath. However, when they get a CT scan, their CT scan looks horrible. And these people may desaturate, meaning your oxygen level in the blood is low, but you are not feeling it. They are getting damaged while they are not realizing it. And it is especially true if you have a COPD or underlying lung problem, or if you have a congestive heart failure or a heart valve problem, then you are more vulnerable for lung injury as well. So I suggest to buy pulse oximeter. You can easily buy it on Amazon or any kind of online store for like $20 to $30. And this is not official recommendation. However, I had a couple of elderly gentlemen who got COVID-19 and their underlying COPD makes it very difficult to figure out what their condition is. He was not doing horrible, but he had moderate symptom and he definitely did not want to go to hospital. So I had to manage him through telephone. So I suggest him to buy this pulse oximeter and then make sure that he is saturating fine at above 92%. So he was saturating 97%, so I felt better. And I got CT chest and it looked horrible. So I called him back, checked the pulse oximeter, and he was still doing good. So it took him more than 2 months to actually fully recover, but he did okay. So this pulse oximeter can be a one handy tool to monitor. Obviously, if you're a smoker or COPD, diabetic, sometimes you do not feel all these symptoms, so we may catch you a little too late. So if you are checking your blood pressure at home, temperature, oximeter, and then you do daily weight and everything is stable, it is safer than if you do none of those. And if you have those and then report to your doctor, then your doctor can better manage you. And obviously, if you think you got infected with coronavirus, then we suggest you get tested for coronavirus. Obviously, you do not want to go to clinic, so you want to go to drive-through testing center. If you are living in LA, you can go to a website, covid19.lacounty.gov/testing. Then it will list all the center that you can get tested. Once you get tested, and if you come back positive, and if your symptoms change, then your doctor can manage you because you have a coronavirus, and we treat you accordingly. If you are negative on COVID-19 and if you are getting short of breath, you may have bacterial infection, not the COVID. You could have a flu, you could have common cold, or you could have a COPD exacerbation, or you can have asthma. All these things still can cause shortness of breath. Some of the disease can cause fever and chill and cough. So we need to know that it is either COVID-19 or something else. If it is negative, then we need to work up on other reason why you are having the problem. So it is helpful if you get tested. Again, if you are really sick or if you feel like you are going to die, you have to trust yourself. That is a bad sign, so you need to call 911. If you are mildly sick, having little cough, having little slight temperature, a little bit of muscle pain, but nothing else, then you know that you don't have to go to ER. So call your doctor and discuss your symptom for further management. And one of the most important thing is if you have any doubt that you got infected for coronavirus, you need to isolate yourself from other people so we stop this transmission. If you do not do that, then you may give to somebody, then person may die. So we don't want that happen. Well, if you have any question, call your doctor, or if you have any general question, please write comment below. Then I will try to answer you as much as possible. I'll continue to talk about COVID-19, but I'll also talk about diabetes, weight loss, hypertension, chronic kidney disease in the future. So if you like this kind of videos, please subscribe and I'll see you next time. Thank you.